Hi, I'm Dr. Jeremy Lam.
I'm Dr. Carrie Lam.
And this is Dr. Michael Lam here to answer some of the questions you have submitted.
Okay, so the first question is, would it be best to follow an adrenal restorative diet or should I follow my blood type diet?
First of all, the blood type diet is a very specific set of guidelines that is tailored to your blood type. It does not necessarily follow adrenal fatigue. Those two are separate things. Now, for example, if you are blood type O, then the tendency for you to tolerate protein and fat tend to be better. However, excessive protein and fat in adrenal fatigue may not be the best. Even though for most people with adrenal fatigue, less carbs and more protein and more fat tend to do better, but that's not universal. We find that people with the blood type diet, it tend to work well maybe in about 2/3 of the cases. But once best if you have a normal healthy, okay? But if you have an adrenal fatigue superimposed on that, then we really have to be customized and tailored. If you are in the middle of the crash, then carbs, protein, and fat ratio are not going to be the same as if you're in a steady mode. If you're in a recovery where you are trying to build up the core, same thing. The ratios change. In other words, the ratio of carbs, protein, fats, etc., they change during the recovery process, and they change during the state. Or different stages of adrenal fatigue. So you cannot compare it. But if you are healthy, for sure, I think the blood type diet could be one that can be considered.
So our next question is, how do you calm an overactive limbic system? I'm a daily meditator. I take supplements, eat healthy, and practice mindfulness, but nothing seems to work. Dr. Lam?
Well, no question that the proper modulation of the limbic system is very important. The reality is that it comes down to the degree of imbalance or damage your neuroFX system is undergoing. Now, remember, there are 6 circuits of the neuroendometabolic stress response that ultimately govern the net overall consequence of what you experience. The limbic system is one of the 6 circuits. And if you are able to repair that, and the body actually has good repairing mechanism, good self-repairing mechanism. But if you have damage in the other circuits, the detoxification circuit, the cardionomic circuits, the inflammatory circuit problems, then you need to pay attention to those two. So oftentimes we have a lot of people that come to us and say, yeah, this client, heroic effort, very consistent, very, very striving to get better, but just cannot get beyond a certain point. And that's the time that we want you to think, hey, are there any other things that they have missed? And that's where a detailed systematic history and the challenges that we give tend to be very important, because no stone is unturned. And if you're in the forest, you don't really see the trees too much, or the other way around. So you need to really be able to step back. And sometimes it's very hard because you're in it for so long, you kind of be blinded, and the lens that you see through the whole body is different than from a third party looking in. Mm-hmm.
Okay. And our last question in this video is from this client here. She's asking, this is new to me. So how do I distinguish the difference between adrenal fatigue syndrome and hypothyroidism?
So first of all, some of the symptoms can really overlap between adrenal fatigue and hypothyroid. And if you go to your doctor, one of the first things that they would test for is actually thyroid function panels, right, by lab. If you go in saying you're fatigued, they're going to run a TSH, a free T3, free T4 maybe, and a total thyroid, and they'll see if you have any thyroid antibodies. And with these numbers, then they will see if you have what you call hypothyroidism as a medical diagnosis. But adrenal fatigue is not really a medical diagnosis that you can go to your doctor and they can run tests on. And so that's why it's hard for people to be able to distinguish unless you truly know the difference with a good experienced clinician. So
Now, remember, you can have low thyroid function, but not necessarily be diagnosed with hypothyroidism. Now, the thyroid gland is very important because it controls the metabolism. If you have antibodies, then the knee-jerk reaction oftentimes is that, well, the person has Hashimoto's. But you can also have low thyroid function if you have a secondary thyroid problem. For example, you can have a pituitary tumor that can also present like that. You can also have adrenal weakness that leads to low thyroid function. Now, as Dr. Carey said, because adrenal fatigue is not a medical diagnosis, that doesn't ring a bell in regular conventional doctors. So, and if once they rule out that you don't have a pituitary tumor, which is quite rare, then it's automatic is to jump to conclusion that you have hypothyroidism. And many are put on medications for that reason. Now, if you truly do have a hypothyroidism and you take the thyroid replacement, you would feel very good. In fact, you would feel fantastic. But oftentimes, unfortunately, it's not true. Many people are put on thyroid medication and they find that they may be marginally better. Sometimes they will only be better for a little while and then it kind of turns on them. And if that happens, that's the time you should have to start look outside and say, hey, are there other things that can cause the symptoms, but maybe my doctor has missed? And this is when you have to start looking into adrenal issues. And if you look deep enough, the physiology is quite different. When you have an adrenal fatigue, your problem starts with the HPA axis dysregulation and ends in the adrenal function being dysregulated, versus the hypothyroidism, which the end organ dysregulation lies in the thyroid. Unfortunately, as Dr. Carey said, it takes a lot of experience, but don't get discouraged. I've written many articles. We have many things online that compare the difference. And if you search, you will find it. It's in our books and articles. And then you get educated and you go back and talk to your doctor. Hey, is it possible that this is not a thyroid problem? Maybe this is a pituitary problem, or maybe this is an adrenal problem, or maybe there's something else. And the investigative process must begin and must be initiated by you. And if you take the active steps to do that, then I think that the answer will be self-evident, and we'll let the truth lie where it lies. No one can run away from it. And if you don't know what questions to ask, then you can call me or call Dr. Carey. We'll talk to you and guide you through on some of the important questions you need to ask your provider, so you get to the root of the problem, because you can't fix something if you don't know what's wrong. So I hope that this will be helpful to you.
Thank you. And also, if you also have any other questions, you can utilize our Ask the Doctor system. Just click on the link below in the description, and you can ask questions that way. Or like Dr. Lam said, you can call into our office and we're happy to answer questions. As always, don't forget to hit the subscribe button, hit the like button, and also the notification button so you know whenever we release new videos. Thank you for watching this video and have a good day.
Bye.